Hello everybody, this is drpal. For the first time ever in our channel, we're going to do a reaction video to an Indian Bollywood film called Three Idiots to see how accurate they were. That's why I put a white coat on, only then you'll recognize me as a doctor. As a matter of fact, if you really want to believe that I'm a doctor, I can actually show you the medical degree as well, because that's how I started my YouTube channel. Please review my first ever video. California physician license. இதுக்கு மேல prove பண்ண முடியாது, and just to prove my credibility. So there's a pregnant lady in the car trying to reach the hospital and it is raining. 100 marks to the actress, perfect action about how people actually feel when they're about to deliver. This is the true uterine contractions. There is another contraction called false contraction, which we call as Braxton Hicks contraction, which means that uterus is not ready to deliver. It might be slightly sensitive, so they have these contractions, but not that strong enough to actually have a delivery.
Hello, Rancho. यहाँ पहुँचना impossible है. अब मैं जैसा कहती हूँ वैसा करो.
So Kareena Kapoor is the OBGYN, maybe resident or assistant professor, I don't know, but she's telling that person that do what I say, then it's going to be assistant professor. Wow, the director's cinematic thinking is at a different level, but it's so realistic, right? Because they have to find some place. So the scene is in the college, so the TT table will be there. Super, wonderful.
Raju, web camera on karo. Raju, Didi kahan hai? Show me.
Don't worry.
So it's not that bad actually. Webcam is very reasonable. That's totally relatable as well, because that's the only thing that could be connected possibly.
We are dying. Rancho, जब दुनिया में हॉस्पिटल्स और डॉक्टर्स नहीं थे, तब भी बच्चे पैदा होते थे. दीदी की डिलीवरी तुम लोग करोगे.
with this screaming, the delivery would have happened by now. So the positioning is pretty good. Look at that. The lower legs are just below the table. Sometimes we call this as a lithotomy position, where the lower legs are wide apart so that the baby can come out of the vaginal canal easily. Maybe if I was a director, I would have actually placed some TT pole or something like that over there so that they can keep the legs over there. So that might one change I might do.
दीदी, push करो.
This exactly happens in the labor delivery ward, where we ask the patient to push as much as possible. We keep saying push, push, push. In Tamil, we say mukku, mukku, mukku. I still remember being a house agency in my medical college. There'll be so many people delivering at the same time. All you can hear is mukku, 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 which means push. That pushing is absolutely important. So look at this. Actually, the actress is doing a wonderful job that she's actually lifting her head, contracting the abdomen so that the baby can come out. Pretty impressive.
Push karo.
For some reason, I feel like Amir Khan during my delivery of my kids with my wife. This is exactly almost the same thing happened. She didn't slap me. She is like, please don't say push. I know what to do. I'm venting out my own frustrations.
Rancho, देखो crowning हो रहा है क्या?
Crowning मतलब?
वो diagram देख रहा.
Wow.
Rancho, देखो सर बाहर आ रहा है क्या?
This is beautiful. They explain crowning. Crowning is where the head of the baby comes into the vaginal canal, trying to see the world by itself, and that is the start of the delivery process.
सर बाहर आ रहा है क्या? Come on, Rancho, जल्दी.
जा.
So, there is this hesitation, right? Amir Khan has done a wonderful job, because usually as a male gynecologist, it's very difficult to actually see a patient because of the, like the stigma that, female patients has to be seen by a female doctor. And there is a movie called Dr. G explaining this concept recently. Actually, I could relate to this as well. When I was in an OBGYN ward, while as a medical student, the patient absolutely did not want me to be in the room, and actually the nurse delivered, and I came at the last minute just to cut the umbilical cord alone, just supervising her all through this, do that. I was the one saying push rather than doing the delivery at that time.
Come on.
See, this is a very, very big problem. I know that everybody always goes inside the blanket and then see what's going on. How will you see what is happening with crowning or in the vaginal canal or whether the baby is there or not if you're having a blanket all over you, right? So you need to have a clear visualization of the field. You know, there'll be like so many lights during the delivery so that even with a small hint of, you know, whether the cervix is dilated, whether the baby is coming out, all these small cues are extremely important.
नहीं नहीं नो नो क्राउनिंग नहीं आ रहा है
दीदी प्लीज पुश करो
So this happens more commonly than what you think. The patient will actually get so tired, and that's why in the hospital we put an IV line in, we give them IV fluids so that, you know, even when they get dehydrated, when they get tired, the hydration might help them to push a little bit more.
उठाओ उसे अगर वो पुश नहीं करेगी तो बहुत प्रॉब्लम हो जाएगा वैक्यूम कब लगाना पड़ेगा ना पिया वहाँ कहाँ मिलेगा वैक्यूम कप
क्या होता है कि कैसा होता है क्या करते हैं उससे
So again, the director has done a wonderful job by creating this concept called vacuum delivery to the public. For example, public should know that just pushing is not the main source of vaginal delivery. You know, people will get dehydrated. It is not that they are putting the effort. Sometimes the effort might not be enough. So in those cases, we do something called assisted deliveries. We take a vacuum, put inside the vaginal canal, create a negative pressure and get the baby out along the vaginal canal in that approach. Ooh. So when you remove the baby, it is absolutely important that you need to actually support the shoulders. First the head, then the right shoulder, then the left shoulder. You know, it is not like you are grabbing something from a supermarket, right? You have to grab it slowly so that you don't end up in a shoulder dislocation.
Turn off कर हाँ
See, again, the biggest problem is he's going inside the blanket again. Especially when you're doing vacuum-assisted delivery, you need significant amount of lighting. You need good exposure. I really don't know how he is going to deliver.
राजू, get on the table. मुझे देखो. बेबी को ऐसे नीचे पुश करो. ऐसे.
हाँ हाँ फरान ऑन कर हाँ
Come on, दीदी. Push करो. You can do it.
Come on, push कर
This was depicted very well now. You need that external pressure from somebody else and the patient herself has to give that pressure. Then the vacuum has to come out. Birthing of a baby is a blessing. It has to happen properly with multiple coordinated movements. It is not an easy process.
तो क्लिप लगाओ. umbilical cord काटो.
तू क्लिप लगा जल्दी umbilical cord लगा ये ले चला क्या चीज
So in cutting the umbilical cord here in US and also in some places in India, the husbands are allowed inside the cesarean section or in the normal vaginal delivery area as well, and they'll be given an option to cut the umbilical cord. That's what happened with me as well, and even though I'm a doctor, I was very hesitant to cut the umbilical cord. More often than not, what happens is people have to focus on that husband who have passed out after seeing the baby or the umbilical cord, and then we have to focus on the actual patient. Wonderful. I think the assistant professor has to change. That nurse has to be the assistant professor.
Huh? Hey, champ.
राजू, उसकी बैक को रब करो.
What he is doing looks like an Amritajan rub on the back of the baby to cool down the back of the skin. That is not how it's supposed to happen.
Hey, champ. Come on, champ, come on. नहीं कुछ नहीं हो रहा है
उसके मुंह में हवा ब्लो करो.
More importantly, more than the breathing, the chest compressions is the key. You have to make sure that, you know, when there is no pulse, not only for the baby, even in case of an adult, when there is no pulse, the first thing that you need to do is to chest compressions on the chest, and then yes, breathing comes too, but first is chest compression. It's It's a very emotional scene, and the point I'm trying to make here is that this is not uncommon. We do see neonatal deaths right at the time of delivery, and that's why they say that when a patient is pregnant, the likelihood of a successful delivery is not 100%. It has to go well in multiple factors, and the majority of them go well, and it is absolutely important to take care of maternal health during pregnancy. Ooh. What happened over there? I think the baby performed sepak takraw, which is the national sport of Malaysia, where they play soccer and volleyball together. I think the director must have watched that sport and then said, okay, how do I combine that sport over here in this climax scene of this movie?
All is well, Bol. All is well. 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 All is well.
I am going to do this in my medical procedures and taking care of my patients moving forward. Whenever I'm having any problems, I'm going to say all is well. I'm not even joking, I'm going to be serious, because I strongly believe that positive thinking definitely will help you some way. Maybe not this dramatic, but maybe a little bit. There we go. This is what should happen right after the baby is born, and that is the sign of a very good healthy baby. Hope you got some kind of medical points through this medical scenes. Let me know in the comment section whether you like these kind of videos moving forward. I will try to dissect this for you from my knowledge. Alright, take care. Remember, this is just a sidetrack of what our focus is. Our focus is one belly at a time. It is absolutely important. You take care. Bye.